But
I've got 5 kids. No, I can't afford it now.
let me give you another analogy and just tell you how absurd our health insurance system is. Imagine who has health insurance through their employer. Raise your hand if you do. Okay, so a number of people raised their hand. Imagine if that same employer gave you hunger insurance. Not that preposterous of an idea. I mean, we need health care to stay alive. We need food to stay alive. So under this plan, you're allowed to go to the grocery store, load up your cart with lobster, T-bone steak, boxes of oatmeal. It comes time to get into the checkout line, and the person behind the counter scans your food, and they give you the receipt. You guys, and then they're like, no, that's not how it works here. Just pay a $5 or $10 copay, and then we send this receipt off to a third-party provider. I see some smiles out there because you know where this would lead. That box of oatmeal would cost about $70 under that scenario because people would buy lots of oatmeal if somebody else is paying. And there'd be no incentive to shop around for your boxes of oatmeal. You just go to whatever grocery store has boxes of oatmeal. It doesn't matter what the prices are. Well, that's kind of what we have in our health insurance market right now. We've lost the incentive because somebody else is always paying. And that's one of the root causes of our healthcare challenges right now, which I would argue is not the healthcare delivery. We got the best healthcare delivery in the world. That's why people come here from Canada, from Great Britain, other countries with national healthcare systems, socialized medicine, for the most serious treatments. Instead, what's broken is the financing of healthcare. And ironically, Congress has just passed legislation that would increase costs. It would bend the cost curve upward. And the whole objective, it seemed, with this healthcare reform effort was to bring the cost of health insurance down so more Americans could afford it. That's certainly what I wanted to happen. And I hope that we can change this legislation and make that happen in the future.
If so many people are dying daily for lack of insurance, why is it not taking effect for about 4 years?
It's a budget gimmick in some respects. We get to start paying taxes on this benefit, so-called now, and these so-called benefits don't kick in for years. Well, it's so that those who passed it can argue, no, it's fully funded, or no, it's not as hard on our budget as you say it is. Well, sure it is. If you're paying taxes for several years and not seeing any benefits, what a horrible piece of legislation. One of many reasons it's horrible. Yes, ma'am?
Talk about health care. According to the bill that was passed a couple of days ago, and I understand it said it has to fix the bill today. I don't know what I have to read it, so I don't know what that is. The bill that was passed a couple days ago, by 2014, only 3% of the population will not have insurance. Which, whether, how we can afford it, that's not my concern. Right? I mean, it is, but that's not my concern. You're going to have all these duly insured Americans. You have nobody to provide for them. The physicians in this country are going to stop. They are limiting Medicaid patients. We're seeing a drastic reduction in physicians in this country. We're estimating to have 157,000 primary care physicians. 9 out of our 10 most prestigious medical schools don't even have a family medicine program. So what can we do, in your opinion, to be able to provide? You talk about, we have the best healthcare system, we provide the best healthcare. But we're going to have all these duly insured Americans, we're not going to have anyone to take care of it. And I just want to...
You sound very informed about this. What do you do? You're a nurse, okay. Yeah. I know that the medical field, generally speaking, there's been a whole lot of conversation going on about this legislation. Whether you're pharmaceutical sales rep, whether you're a registered nurse, like my mother is, whether you're a doctor, like the one I talked to today in Seymour, 6 other doctors in his practice, thriving practice, years ago, but he thinks he's going to have to go out of business as a result of this piece of legislation. You mentioned the potential practitioner shortage, and that's something that I'm hearing time and again is a real concern. I'll just tell you, without getting into the numbers, because I share your concerns, do we now have to subsidize people to go to medical school, which is going to cost more as a result of this legislation, which is going to make us pay more for health care anyway? I mean, just the unintended consequences of this really concern me. But I'll say this, I wouldn't go, and there was a period of time back in high school when I thought about maybe someday being a doctor. I don't think I'd go through all the years of medical school if I'm going to be a highly regulated practitioner, if I were to be a little more flip about it, a bureaucrat. You know, is that really why you spend all this time to go to medical school? So, yeah, I'm very, very concerned. That's why I think we have to fundamentally reform this legislation. Maybe just kill it, start over again, and put some real common sense, what I think are common sense provisions on the table. We've talked about tort reform. We've talked about allowing people to purchase health insurance across state lines. We haven't talked about pre-existing conditions yet. Let me tell you a bit about my thoughts on pre-existing conditions. I have great sympathy for somebody who loses their health insurance as a result of losing their job. Maybe, God forbid, they get divorced. They lose their health insurance. They go out, they get some horrible disease. They go back into the marketplace after not having insurance for a short period of time. They try and purchase insurance. You've heard these stories before. They can't afford it. That's a tragic situation. So how can we address that? Well, there happens to be a real market solution, one that doesn't involve government mandates, which is the Washington, D.C. approach. It's called health status insurance. I haven't heard any members of Congress, I haven't heard any candidates talking about it. If you go on the Cato Institute website, it's right there. An economist by the name of Cochran out of the University of Chicago says, look, why don't we put a strip of insurance on top of your existing insurance plan? You buy a little bit of additional insurance, and that insures you that should you ever find yourself in that position, you'll lose the insurance plan, you can go back into the marketplace and be assured that your health insurance premiums won't cost any more than you were paying before, maybe adjusted for inflation. Boom. Problem solved. You have control over your own condition. You can guard against not having insurance should that ever be a situation you find yourself in. It's a great situation, I'll tell you, as someone who is now the father of 2 newborns, my wife and I, assuming all the regulatory barriers to health status insurance were removed, my wife and I could have insured our 2 unborn children